keeping with Chiropractic Head to Toe Month, we're going to be talking about hip and pelvic pain. So we have many patients that come in and see us reporting some sort of hip low back pain. So I'm going to show you a couple things that we do right off the bat to check and make sure everything is moving properly in the pelvis. Okay, next let's get rid of that pesky hip and pelvis pain. So what I'm going to be doing first is checking his hips, then I'm going to flip him over and check more of his pelvic alignment and see if there's anything we can do to balance him out, okay? So first what we're going to do is I'm going to feel the range of motion in his hip. I already feel something there. I'm going to do some muscle tests. So I'm going to push this way, hold tight. I'm checking one of his quads here. Try again. Good, he's got a little weakness there. Straight here, I'm going to push. This is one of his hip flexors. I'm going to push here. Okay, so he's got a little bit of weakness on this side. So I'm going to adjust his hip. The table's going to drop. Good, just like that. And we're going to retest. I'm going to push this way, hold tight, solid. Straighten here, good. I'm going to push, hold tight. Beautiful. Can you flip over and go on your stomach? So that's hip. Hip is done. Next, we are going to check his glutes. Okay, so I'm going to have him lift this whole leg up. I'm going to push. I'm going to have him lift here. I'm going to push, so he has a little bit of weakness in his glute on the right-hand side. That tells me he has a torque or twist happening in his pelvis. So we are going to figure out how to untorque or untwist his pelvis. Lift here for me. Good, so that is what we need to do. We need to set the drops for him here. Good, I'm gonna push. Good, just like that. And I'm gonna grab these. We're gonna recheck one more time. Lift here. Beautiful. Okay, we're gonna do one more muscle test. I'm gonna have you bend here. This is checking his piriformis. Push down. Good. Piriformis is directly related to the sacrum. So if we find weakness, that tells us we need to do something with the sacrum. I'm going to push, and he's weak here, okay? So bring this back here. Good. So we need to figure out what part of his sacrum needs to be adjusted. He's a big right-sided guy, we know that. So I'm going to adjust the top right part of his sacrum. One more. Good. And recheck. Push down here, and now he's strong. Good. Those are the basics of how we handle hip and pelvis at Chiropractic Health and Wellness.